Good morning and welcome to our discussion on cardiac risk at work. This is a panel session today hosted by HCA Healthcare UK and Feel Good. Cardiovascular disease remains the leading cause of death in the UK and globally, despite the fact that many cases are preventable. And that's why we've put together today's session. It's a session specifically for you, those of you who work within central HR teams, wellbeing, insurers, brokers, anybody who has the opportunity and the accountability to champion education on this topic, to encourage early diagnosis and screening, and who can affect and improve the outcomes of the return to work process. So I'm so pleased that you've joined us here today. My name is Jill Williams and I am an organisational psychologist working with Feel Good. Now, I'm no expert on this topic, and that's why I'm absolutely delighted to be joined by two experts in their field today. So I'm really pleased to be joined by Dr. Niaz, who is the Chief Clinical Officer at HCA Healthcare, and also by Dr. Sundip Patel, who is a deep specialist and consultant cardiologist as well. So to start off, I think it would be great to hear a little bit about your backgrounds and to hear a little bit about the work that you do, because I know you do so much work collaborating to improve outcomes for patients and for organisations through your work. Niaz, can you tell us a little bit more?
Sure. Well, firstly, Jill, thank you so much for having myself and Sundip over to this fantastic event. My name's Niaz Khan. I'm a general practitioner and occupational health physician by clinical background. And I've been heading up HCA Primary Care's Clinical Innovations Board for a number of years. Sundip and I have worked together, as you say, for, well, I think it's probably over 10 years now, isn't it?
Correct, yes.
And we've worked on a range of initiatives over that time, some within the screening space, some within the investigative space, but we've done a lot of work on bringing screening programs more to the corporate sector and with the aim of identifying cardiovascular disease at an earlier stage. And that's really been foundational to our work together, hasn't it?
Indeed. So Jill, thank you. Thank you all for the invitation. As Niaz said, we started collaborating about 10 to 13 years ago. It was through education. We wanted to educate, we wanted to learn, we wanted to educate our colleagues about heart disease, its early detection, and that's how we forged our relationship professionally. And I work as a consultant cardiologist at HCA and also in the NHS. And in the latter position, I often see the end result of heart disease, sadly. So my desire and passion for many years has been prevention, risk management, as well as treating patients who've had an event. And that's how Niaz and I have been working together, ultimately for each individual to lower their risk of a problem in the future.
Fantastic. Well, it feels like such a pleasure and such a privilege for me to be here speaking with both of you and how complementary your deep areas of specialism are. So I have lots of questions for you, and I'm sure everyone joining us will as well today, and we will be taking questions towards the end from our audience, so do submit them as we go as well. But let's start with a general question, and yes, I'll come to you with this. Why or how does cardiovascular disease impact the workforce?
I think it's a fantastic question, Jill. And I think in order to answer that, I think we'll take a step back and understand a little bit about what cardiovascular disease is. I think in broad terms, cardiovascular disease is a range of medical conditions. It can be anything from angina to atrial fibrillation to stroke. All of these things come in, under the umbrella. The challenging thing with cardiovascular disease, I think, is that often it's hiding in plain sight. Now, what do I mean by that? Well, a number of medical conditions, sometimes they will be there without symptoms. Sometimes symptoms might be due to develop, but they haven't done up to this point. And in other cases, symptoms may already have developed. Now, one of the key things about early detection is to try and identify who those affected individuals are at the earliest possible stage. And how can we do that? Well, screening is the only way to do that. The other challenging thing about cardiovascular disease is that it's pretty ubiquitous within organizations. And again, what do I mean by that? Well, the incidence of cardiovascular disease is so high that we know that it can affect many different types of people, not just your classic older male, but actually females, ethnic minorities, and so on and so forth. So I guess the impact of these conditions, and we'll talk a lot more about what that looks like in terms of, sickness, absence, unwellness, time off work, the need for reasonable adjustments, etc. But fundamentally, the impact is big. And again, the only way to really mitigate against that risk is to understand, well, what are your numbers? And what do we mean by that? Well, it's all about screening. And we'll talk a little bit more about what screening looks like. And I know, Sundip, you've got a viewpoint on screening and early detection. So I might just palm off to you at this point and see what you think.
Yes, well, Niaz, cardiovascular disease and risk prevention is important for the simple reason of these following few statistics. If we look at the workforce age between the age of 20 and 64, a recent survey by the British Heart Foundation showed that 55% of that population will suffer a significant heart event, and probably that proportion will also die from that cardiac event. So for the workforce, it's a major health burden. Then if we look at the broader population, Jill, in terms of heart risk, under the age of 35, about 60% of patients who die will have a heart-related condition under the age of 35. Over the age of 35, those who die, 80%, up to 80%, will have a heart condition. So we don't need to say any more. Heart screening is pivotal to our population, to our workforce, to our individuals, to ourselves. And it tells us, particularly this next fact, 1/3, 1 in 3 patients who come to our A&Es with heart attacks, if I ask them, how were you last week? How were you week before? Absolutely fine, Dr. Patel. I was doing the garden. I was building a shed. I was absolutely fine. They have no prior warning symptoms. So as Niaz said, the disease process is silent until you hit the cliff edge. But we can detect it earlier. And working with a team in collaboration, using state-of-the-art technology with the right clinical approach, Jill, we can make a difference. And that's what we should be doing.
Absolutely. Those numbers really speak for themselves, don't they, Sundip, in terms of challenging some of the preconceptions we have about who might be at risk here, when actually what you're saying is it could be any of us, it is all of us in that sense. And if there is that sort of hiding in plain sight, as you've said, Niaz, then how do we start to surface it? How do we start to uncover it? And that's where the screening sounds so important. You've both touched upon numbers there, and I'm interested to hear a little bit more about this idea of knowing your numbers, if Niaz, you could expand upon that. However, as we do that, I'm going to ask everyone who's joining us today to answer a question to see whether they know their numbers as well. But what are we talking about here?
So, great question. So what is this notion of knowing your numbers? Well, at its simplest, it's understanding what the quantified values are associated with your risk factors. So what are your cardiovascular risk factors? Well, they can be very simple things like weight, blood pressure, cholesterol, even some binary things around exercise, how frequently you undertake exercise versus how much exercise you should do, whether you smoke or take alcohol, quantifying those, and looking at things in the round from a risk perspective. Now, there are many different levels of health screening that people can undertake. Even the simplest ones are pretty effective. So what we would always tell our patients and our corporate customers is some screening is better than no screening. And that's what we would firmly be recommending. So knowing your numbers, it can take many different forms. But what we would really encourage our corporate partners is do something, because it's going to be a lot better than doing nothing.
Absolutely. And I think that's an important message, that so many professionals feel so time poor. Oh, I don't have time to prioritize this. Oh, it's a preventative thing. That won't affect me. Back to our points about perhaps those stereotypes and assumptions we make. But actually, you're saying it can be short. It can be a small amount of time. It might only be 10 minutes, but actually you could learn a lot about yourself in that sense. And whenever you sort of see screening like that, what would you add, Sundip, in terms of what quality screening can look like without it being a huge impact on time for people?
So that's a very good point. So screening in its simple form is looking for something that we can change to lower risk. And We work in a very collaborative manner within HCA. There is no divide between primary care colleagues such as Niaz and the specialists. We work together for the better of the patient and the individual. And therefore, when the patient comes for their screening, it's the start of a journey. In HCA, the screening is led by a clinician, a clinical medical specialist, who will ascertain risk, who will quantify risk, who will then guide that person to the right clinician, and that might be myself. And then with that data that's already been gathered, very sophisticated data, which I'll touch upon shortly, we will then tailor the risk management for that person. It's bespoke. It's not broad-based. It's individual. As you said, Jill, we're all at risk. Whether you're 35, 25, exercise, slim, overweight, don't smoke, smoke, we are all at risk. So in my mind, the management of risk should be bespoke and tailored, working with many other colleagues. And that would be primary care, physician, nurses, specialists. In terms of going forwards, what we can offer once that person's journey comes to our front door is state-of-the-art, cutting-edge technology that quantifies risk non-intrusively, safely and effectively. And really, one of the biggest advents, Jill, has been non-invasive specialist CT coronary scanning. A scan that takes 20, 25 minutes out of your diary. Come in, have the scan done, very safe, very low dose. HCA has some of the highest resolution low dose scanners in the country. We can then quantify your heart risk visually. We can get a metric that's evidence-based. And with that, I can say your risk is this over the next 8 years. This is how we might want to manage it. And we can guide the patient. And that's the ethos and philosophy of our cutting-edge, state-of-the-art screening and caring for the patient and individual.
That's fantastic. You know, really thinking about that level of innovation that allows you to be able to spot personal risk factors and then build a very bespoke way of managing that risk is just phenomenal in terms of how things have moved on in that sense, and really powerful for individuals to have that insight and to understand, well, this isn't a broad brush, it isn't one size fits all. And I think what really resonated with me as well, Sundip, was what you were talking about being non-invasive. You know, that fear factor can often get in the way. Well, what am I going to have to go through to find out what my risk is? And finding out your risk can be a psychologically daunting thing anyway, never mind what that feels like to actually go through the process. So it's fantastic that the patient experience is non-invasive in that sense, absolutely.
And if I may, the innovation starts before it comes to me. Niaz, if you could maybe talk about how we collaborated on using innovative, cutting-edge technology techniques that you can offer to your clients at the front door.
Yeah, fantastic question, Sundip. And I think when we look at innovation, Jill, often the tendency is to think of innovation as the most sophisticated technology out there, and appreciate, cardiac CT, which Sundip has mentioned, is at that very pinnacle. But that isn't to say that other less technologically advanced innovations are any less good. And Sundip and I, what Sundip was referring to there is, some years ago, we looked at our screening program at HCA Primary Care Division, and we realized actually we could do this a little bit better than what we're doing it. And we looked at a range of tests, laboratory and clinical. We measured them up against the clinical guidelines and the evidence base, and found that actually two relatively non-technical, technologically advanced tests could be used in primary care to understand which patients were likely to have coronary artery disease. Now, those two tests were a lipoprotein PLA2 blood test, and the other one was pulse wave velocity. Now, the two tests are essentially biomarkers and indicative tests of underlying coronary disease. And our research tells us that it gives us a 2 in 3 positive predictive value of who will have underlying coronary artery disease. And of course, those patients who test positive for these two tests, we would be referring them for cardiac CT. And so the outcomes that we've had have truly been fantastic. And I think it's a testament to collaborative working and integrated care pathways that we have at HCA.
Absolutely.
And one is a blood test to allay the fear of the patient, the member. It's not a specific. One is a blood test, and one is a sophisticated blood pressure measurement, which can yield such powerful data done at the time of your health screening.
And that's incredible, that done at the time of your health screening, you can get that powerful data, which has such a strong statistical validity to really be able to inform that personal risk. And I think, as you say, innovation can take many forms, and even being able to take a very bespoke and personalised risk management pathway is a form of innovation versus how things were treated in the past. Absolutely. So I'm definitely feeling very sold on making sure I know my numbers, and it's really interesting to see our results. And for those of you who are joining us today, we've got about a pretty close to 50-50 split, and 51% of you saying yes, you are the role models, you do know your numbers, and given the roles that you do, it's great that you are advocating for this and leading the way. For the other half, I really encourage you to listen to what Niaz and Sundip are saying and go make that appointment, have your screening done as well. And I'm going to use this opportunity for us to hear a story from Annabelle. So Annabelle is an employee of HCA Healthcare, and she has very generously agreed to share her story today. So Annabelle discovered, whilst having a health check herself, that she was diagnosed with an aneurysm of the aortic sinus in the left-hand side of the heart, which is also known as the sinus of Valsalva. And this is actually a life-threatening condition. No symptoms, so it was the screening that helped her realise that she had this. So let's watch and hear from Annabelle now.
Can you tell us what stopped you from booking a health screening sooner?
This is something I still kick myself about, because it was just putting the time in, taking the time off work and going and having all the tests. And if I'm being really honest, there's a bit of, I don't really want to know. And I felt absolutely fine. So I just deferred it until something obviously clicked to me, and I thought, no, I must go and get this done. I was pretty asymptomatic, and the only minor thing that I'd had was a bit of palpitations and not sleeping very well.
And what did the GP notice that prompted further investigation?
I think the slight elevation in blood pressure, but it was mostly my family history that I think prompted her to say, look, there's no harm in doing these tests. If they're absolutely fine, you won't need to do them for another 5 years. We'll then have a good base rate. And she was just incredibly diligent and really listened hard to everything I told her. Went in on a Monday evening, and my surgery was on the Tuesday morning, so I had a night in hospital beforehand. Nothing can prepare you for sort of the discomfort you feel, and also then just not being able to sit up without it being a huge effort. So it's all the little things.
What was it like returning to work after your treatment? Did you feel ready, physically, emotionally, or otherwise?
Well, I was told categorically that, I wouldn't be back for at least 4 months. So I sort of had a realistic time frame in mind. The first 6 weeks of recovery were difficult. The physio was painful. I was very tired. But I had the use of psychologists, which really helped me actually just get over that. And then, cardiac physiotherapists. And I think the rehabilitation bit is as important, if not more important in some ways, than the surgery, because the surgery is only one element of what's happening to you. And to get yourself back into physical shape, it was actually quite demanding.
What would you say to employers about what's most important when supporting someone returning after a health journey like yours?
I think it's letting people realise when they're ready to come back to work, and that changes for every individual, and people cope in very different ways. But I think not having to worry about the day-to-day routine of things and knowing that people are taking care of that for you, for me, was the biggest, gave me permission in some ways to just concentrate on myself and my recovery. I really hope that if people are offered health screening, whether it's in the NHS, whether it's through a work programme, whether they do it themselves, that people really take note, because so much is preventable. And what I was diagnosed with could have been fatal had I not had this screening. And there are many people walking around with things that they don't know they have that could be treated much earlier, they'll recover much quicker, and it's just so important. I will never miss another health screen again.
Thank you, Annabelle, for sharing a really, really powerful story. And for me, it's really underlined the points that Sundip and Niaz are making today about the importance of that screening. And Annabelle had started to touch upon as well in her story a little bit about returning to work and what that experience was like for her. What challenges do people tend to experience, Sundip, when they are coming back to work after an intervention like Annabelle's or a cardiac event?
So, Jill, there are obviously many facets to this. There's a physical aspect. Someone will feel afraid, vulnerable of their recovery period. There's the mental health and well-being, and again, there's vulnerability. There'll be low self-esteem. Why have I had an event? I thought I was looking after myself. There may be effects related to the medications. But what we do offer at HCA is that team multidisciplinary approach. And with someone like Annabelle or other cases, there would be a clinician, such as myself. There would be a nurse specialist. There'll be a pharmacist. There'd be an exercise specialist. There'd be a post-operative nurse specialist to guide the patient through their journey. And more often than not, if we get together early around that patient, provide our expertise together, the outcome can be very good. Naturally, there is a bigger impact for the patient returning to work, for their colleagues. Often a patient will come to me and say, my colleague had a heart attack, I'm really scared. So there is this fear as well that can be spread across the work environment. And obviously, Niaz, you deal a lot with workforce groups and so forth. So it'd be interesting to know what your thoughts are on that.
No, thank you very much, Sundip. I think Sundip's touched on the patient care aspects really well, I think, and fundamentally, it's the same thing on the employee well-being side. Multidisciplinary care is fundamentally very, very important. But before we go into some of the more professional aspects of employee well-being and occupational health and those sorts of things, probably just want to circle back to some of the softer side of working in an organization. And fundamentally important is having a positive workplace culture, supportive line management, and acknowledgement of some of the difficulties that the individual may have gone through. Now, cardiac disorders are tricky, as we know, and Sundip's gone through much of the nuance of that. And it can be very, very tricky. Now, what I would say is that HRs are already doing a fantastic job in the City of London and more further afield. But there is professional support available in that domain, and that would come in the form of occupational health. So having access to a really good occupational health service can make all the difference. There are a range of levers that occupational health can pull. They can be from an advisory service to HR, but also to the employee themselves. Other aspects might be recommending adjustments. Many cardiac conditions will be attracting coverage under the disability provisions of the Equality Act, and often HRs will find it very useful to know where the individual sits on that spectrum. So a really in-depth assessment from occupational health can make all the difference. And what adjustments are relevant to that individual patient? Well, that would depend on the specificity of the case. But I think it's a great service that can be really beneficial both for employee and also for the employer.
Absolutely. And I think there's a wide range of things we're talking about, from the physical to the mental, and the support that people need and the support around them as well. And it's great for everybody who's joining us today to think, where can that support come from? And occupational health is a great example of that. Do either of you have any examples of where organisations maybe get it wrong with the return to work, and anything they can do to sort of counterbalance something that perhaps hasn't been done so well?
I think the most important point I would make here would be that organisations generally do a very good job. And there are very few examples of, or at least of what I've seen, that have been contrary to that. But the things that often employers might be at risk of getting wrong would be around not recognizing the psychological impact of a serious cardiovascular diagnosis. We've all got these biases where we'll focus very much on the physical disability, the physical impairment, but not take into account the full extent of the psychological picture. And therefore, it can be quite easy to underestimate an individual's capability to be productive in the workplace. Other, perhaps, suboptimal outcomes may include not making enough reasonable adjustments to support those individuals, or expecting that things will improve very, very quickly when in actual fact they may not. So I think, I would just like to reiterate that we generally see a great many examples of excellent practice by HRMs and occupational health. The number of small cases where things haven't gone right are very, very few and far between. But Sundip, what's your take from what you've seen?
So we obviously look at the individual that's maybe a part of a workforce that you may be involved looking after. I would say this, Jill, with innovation, technology, medications, science, advancement, my philosophy that I tell my patients who come with a significant heart issue is, we will get you back to your normal life. You will be able to do that cycling, that marathon, that 10K that you've put on for charity this year. You will get back to it, but we will go through a journey. Mm-hmm. And I always say that journey is going to involve me, your GP, dietitian, pharmacist. So again, reinforcing how with many people looking after the individual, the journey can be better. And we are seeing younger, fitter people suffering with heart disease walking through the door, and it has a major impact on them, their partner, their family. And it takes work, time and effort from all concerned to look after that individual, to get them back into a normal life and their normal professional capacity. But we can achieve that with the right team and the right people and working across all parties.
Yeah, I think I'd probably just take things just a small step forward from what Sundip said. The ultimate aim is to ensure that that employee or patient is central to all of those decision-making processes. And I think if we can achieve that both on the therapeutic side, but also on the employee well-being front, I think we can avoid some of the negative externalities that are associated with cardiovascular disease. And what that may look like for organizations is loss of productivity, loss of employee trust, a loss of psychological safety or perceived psychological safety. And beyond that, there could be other externalities such as prolonged sickness absence, an increase in group income protection claims, and so on and so forth. So I think, to Sundip's point, multidisciplinary working is fundamental to this, and it transcends the clinical teams. And it very much involves key players within the employment space as well.
Absolutely, and I think that's coming across so strongly in what both of you are saying in terms of that multidisciplinary approach and how organisations can take that as well. It's not just in the therapeutic space, and I know we have a number of people joining us today who are working with that mindset and working with that approach to really support the return to work. I think everything you're saying, Niaz, is just really reinforcing in terms of why prevention is better as well. Those negative outcomes that you talked about for organisations, if we flip those, if we're able to prevent this, reduce the incident in the workplace, that's not only fantastic for the individuals that we're talking about here, but also, is going to increase that productivity, keep people happy and healthy in the workplace as well. So really reinforcing that there's a lot you can do to support after an event, but let's not forget that prevention is the core aim here as well. And with that in mind, I'd like us to watch another video. And again, we have got someone who has very generously offered to share their story with us. So I'd like to introduce you to Nick, another employee from HCA Healthcare. Thank you, Nick, for giving us your time and your story. So Nick experienced chest pain during a cycling workout. So to Sundip's point in terms of, young, healthy, active, perhaps people who don't expect to be at risk. He dismissed it as a minor issue, and then he had a scheduled GP appointment, which led to some further testing and revealed he had likely suffered a heart attack at that moment, and he had to seek urgent confirmation. So Nick's going to share a little bit with us now about what his experience was like.
the one thing I've learned is waiting is never the right option. So certainly if anyone's feeling any symptoms, no matter how minor, I'd say, go to talk to a health professional. You can, get them checked out. You'll do yourself psychologically so much more benefit, if nothing else. And if, God forbid, there is something that you were right to be worried about, well, it's always going to be better treated earlier than it is to be treated later. So it's difficult, especially for us chaps, but there is always a point in time when you go, there's strength in vulnerability, I guess, from that perspective in all definitions of the word.
Great. Thank you, Nick, for sharing. It's been really powerful to hear both Annabelle and Nick's stories today. I have thousands more questions, but I'm going to open the floor to your questions now for Sundip and Niaz. So the first question that we are going to discuss this morning is the strategies that employers can implement to reduce cardiovascular risk amongst employees, especially those who are either in high stress or very sedentary roles. And I think for a lot of people who are joining us today, they will understand that. High pressure environments, they're very common, as are sedentary roles. How much of us spend so much time tied to a desk for upwards of 8 hours a day? Sundip, what's your view about managing risk in these situations?
Very, very good question, very pertinent. Jill, at the risk of repetition but consistency, knowing your numbers, that mantra is a great initial portal for someone to realise, actually, my blood pressure's a bit up. I've been down to see the nurse on the 4th floor in my high tower office building, and she said the blood pressure's up a bit. I think I'll just go and check in with the GP next week. Once we know a little bit about that person, we can then guide them. Naturally, there's lots to be done on health, lifestyle education. Brisk walk, 30 to 40 minutes, 5 times a week without stopping, becoming a little breathless and sweaty in your lunch hour will lower your cardiovascular risk and lower other risk metrics. So the strategies are very simple. Health education, health awareness is pivotal. But the fundamental, initial, simple mantra is for each individual in the workforce to know their numbers, not 50%. Should be looking at 80 or 90%. And that's one simple, cost-effective way of reducing risk.
And as HR teams, that's something very easy to educate people on, build that awareness. I used to work as an HR director, and we did campaigns about so many things, but actually we never did one on knowing your numbers. So it's about thinking that is something that is cost-effective, quick, but can reach so many people and drive up that percentage of people, as you say. Absolutely. Yes, what would you add?
Well, I think I've been fortunate enough to see so much evidence of excellent practice by HRMs across the City of London and more further afield. I think it doesn't necessarily have to go straight to the medical side of things, and some lifestyle support can go a long way. I've seen initiatives that encourage employees to stand more, take a break from the workstation and take a walk. I've seen subsidized or reduced cost gym memberships, either in-house or outside the office. Encouragement also for healthy eating strategies. So those organizations that are fortunate enough to have an in-house canteen, maintaining those to ensure that they're nutritionally adequate and don't contain high amounts of sugar or saturated fat. So I think there are a number of initiatives that can be done from a preventative strategy perspective. I remember one employer had a snack station, and you thought there'd be lots of unhealthy things, but they were really, really healthy things. And I thought that was a great idea. I think they did a great job. But to Sundip's point around knowing your numbers, there is no substitute to that. We've already established that cardiovascular disease is very tacit. It can come up on people you wouldn't necessarily think would or should suffer those conditions. And so understanding what those risk factors look like in the individual will go a very long way into supporting those people to maintaining good health and preventing those things from ever being an issue.
So that awareness, that education around risk and around knowing your numbers, but also what I'm hearing is small, tangible changes that can be nudges, that can be the offer of something that shifts a lifestyle factor for someone will ultimately reduce risk as well in an employee population. So whilst we know the importance of the bespoke and the individualised, if you're looking at a large or a small organisation, even if your budgets are small, there's still ways to introduce things such as standing meetings, standing desks. If you haven't got the budget for a private chef and a buffet of healthy snacks, there's still things to do as a smaller or a more financially constrained organisation as well. And I think that just shows how powerful the small changes in the workplace can be. And I think adding my organisational psychology hat on, I would also encourage organisations to think about, the role of stress and what is actually causing the stress in the workplace. Sometimes we think it's about the rate of work. Sometimes it's more about the relational elements, and look at, is there anything we can do to drive that systemic change as well? Absolutely. Thank you both. Great. So we've got some great questions coming up. So we've touched on a little bit there about budget, but we've got a question about that to look at a bit further. So if we have a finite budget for health and wellbeing services, should we be diverting more of that to health screening than to traditional private medical treatment? Is there a business case for that?
I think I'll try and take that on, Sundip, and I know you've got some thoughts on this as well. I think it's a fascinating question. I think it's a very difficult question. Our experience has taught us that most organizations have a finite budget. And we know from some of the research that we've done in that every pound that gets spent on screening probably saves about £2 in secondary care expenditure. So in response to the final bit of that question, is there a business case? We think so. To go back to something that you said earlier, Jill, about prevention and the benefits of prevention, it's a fair question. Is prevention better than cure? Well, again, it might well be. If we can identify individuals before they get sick, then fundamentally we can, we'll be doing the right thing, not just for that individual, but for their employing organizations as well. So I think, like with most things, there's a balance between having enough up front. I remember one of the HR directors at one of the organizations that we serve said, well, screening is the first line of defense. So if you don't have a first line of defense and you're reliant on, the more sort of private treatment at the second line, well, your outcomes might not be quite as good. But Sundip, I know you've got a lot of thoughts from your side because you've seen a lot of this over a great number of years. Be interested to hear your thoughts.
Well, my thoughts are very similar to yours. You won't be surprised to hear, Niaz. If we can stop that one patient having a heart attack through screening early at the age of 30, then the cost benefit is huge. And I may not be addressing the question directly, but just as a clinician, the cost benefit to the individual, to society, to the employer is vast. So I believe that screening should be the first line of defence. I really do. And it's through that we can pick up other conditions. Through our screening, Jill, even cardiac screening, we've picked up early breast cancer, lung cancers. That highly sophisticated CT coronary scan will look at the whole of the chest. And we've picked up incidental cancers, caught them early, treated them early. So the rewards are far and wide for the right patient along the right journey.
I think Sundip's point is very well made. Often those risk factors that predispose individuals to cardiovascular disease are the same risk factors that predispose individuals to a host of other conditions, including cancers. So I hope that answers the question.
I hope it does. I think for me it does. I hope for the individual who asked it, it does for you as well. But I think the message is there that there is a strong business case and a strong health case for access to screening and to really think about prevention as being a very important part of your strategy and where your spend goes. And I think that's fascinating to hear in terms of what else can be picked up as well. So thank you both for sharing on that. We have a few more questions coming in as well. One is around conflicting information about diet, lifestyle choices. And I think we all know if you go on any social platform or pick up any publication, there's always someone with a different view. How can organisations help people really understand where is the evidence-based quality advice in everything they're reading?
Well, I hope this is not a too brash a statement. I'm going to give them the guidance.
I love that. A trusted source, that's what we're looking for.
There have been many clinical trials looking at various dietary lifestyles. And in cardiology, in most of medicine, everything now, Jill, we talk about is evidence-based. Where's the evidence for me washing my hands? Where's the evidence for me having this sort of diet? There's only been one diet that, amongst all the others, has been rigorously tested at least on 2 separate occasions over several years. And I know it sounds boring, but the Mediterranean diet is the one and only diet that has been shown to lower cardiovascular risk. So that is your olive oil, your fruits, your vegetables, your pulses, your grains, your white meat, fish, oily fish, grilling your food, and so forth. So the Mediterranean diet is the one and only diet at this stage that has the evidence base.
Fantastic. And I think it's such an important question for everyone to be asking, whatever they're reading, listening to, hearing, is what is the evidence? Where is that evidence from? And really interrogate that. And if they can't find that evidence, just pick up the phone to you then, Sundip, I think, and you'll guide them back to the Mediterranean diet. Yeah, absolutely. So we've covered so much today, and I think I've taken so many points from everything you've both said in terms of the importance of prevention, the critical role that early screening plays in that, how that enables the personalised, the bespoke approach to risk management, but also the nuance and the depth that goes into effective return to work after an intervention or an event, and how really organisations must take a multidisciplinary approach to supporting both the psychological and the physical aspects of that and how that comes through. So I've definitely felt very inspired to make some personal changes, but also in terms of some of the work with my clients as well. So thank you both for your time. But as we look to wrap up the session, I'd love to ask you both to leave those who've joined us today with one lasting message or one lasting thought from the session. Niaz.
Well, thank you, Jill. Firstly, it's been a pleasure to have been invited and to speak at this fantastic event. If there was probably a call to action, I would be asking our colleagues and peers in HR and organisations to encourage individuals to know your numbers. And what does that mean? Well, in order to explain that, I'll pass on to my learned colleague to the left to go into a little bit more detail in that regard.
Thank you, Niaz, and thank you, Jill, and thank you everyone for joining. So the mantra is, it's better to stay out of trouble than get out of trouble. And building on that ethos of knowing your numbers, there's a new concept called the 8 pillars or 8 ounces of a healthy heart or cardiovascular system. Healthy sleeping, minimizing work stress. Diet, exercise, physical activity, and not smoking. So those are the 4 non-medical pillars for everyone, at work, at home, friends, neighbours. And then the 4 numbers: body weight, blood pressure, cholesterol, blood sugar. If institutions, employers, workforces can work on these 8 simple pillars through simple, cost-effective measures, the burden of heart disease will be reduced for sure.
There's so much that is controllable and influenceable within that. So that's a really positive and empowering message, I think, for us to finish on. Thank you both so much for your time and your insight. And thank you everyone for joining us today. I hope you feel inspired to continue the great work you're doing to support your workforce with their health, their well-being, and their cardiac health within that. Of course, if there's any questions, do get in touch with us at Feelgood or HCA to follow up on today's session. But thank you for helping make prevention of cardiac health issues possible in the workplace. We hope to see you at a future event soon.